Okay, hello everyone. My name is Sakari Nikinmaa. I'm a CEO of Koite Health. Today I'm going to tell you about my journey from Helsinki Children's Hospital to improvement of oral health. So like Janine, I was a Biodesign Innovation Fellow 2016, where me and my team went to the Children's Hospital and observed all different needs, different topics we could improve. And I fully agree with Janine that there is a lot of things what we can do better. A lot of applications they use in Children's Hospital are not really made for children. I won't spend much time to this, but this was the process we also did. So we found different needs. We made a concept from those. We innovated different ideas how we could solve. And eventually we got to the phase where we wanted to do a strategy, how to build a business out of this need. But for me, the most important thing was meeting my co-founder, good friend of mine, Tommi Pätilä, who still works as a heart surgeon in Helsinki University Hospital. And through him, I got the in-depth contact with what it is actually to be a clinician and what type of problems arise in a hospital setting. And what Tommi told me at the time that actually he operates a lot of different diseases like heart infections, which have an oral origin. So bacteria entering bloodstream through oral infection and causing infection in the heart. And this is also affecting children, not only just adults. And what is the underlying problem with the development of oral diseases? It's bacteria. The bacteria build up on surface of the teeth and gum line and cause local infections. They are asymptomatic, you don't see them, but when you give them time to build up, they will start infection of the gum and also produce acids, which will then start solubilize the enamel as well as denting, eventually entering to the root canal of the teeth, causing a direct exposure bacteria to blood. And the surprising thing or worrying thing is that 1 of the 5 children have a so-called virulent Streptococcus mutans strain, which causes them to have high risk of dental decay, so caries, and have a poor treatment response to traditional caries prevention and treatment methods. This means that these bacteria, they have ability to attach themselves to the surface of the teeth so well that you really cannot remove them by toothbrush. And then they will start building the disease forward once, like every time you eat sugar diet. And with the children, you can see in the bottom right corner, we have this issue called rampant caries, meaning that some of the children develop so severe caries, it affects pretty much all of their teeth. And then that causes dentists and doctors a big problem, how we can treat these persons who have ongoing bacteria infection in the mouth. And this was actually the solution we came up with. So we wanted to provide an antibacterial method where we can target that dental plaque or bacteria which is left on the surface of the tooth after brushing the teeth and flossing. But if you have something which is really strong in terms of antibacterial strength, then we need to be specific. We cannot treat the whole mouth. We need to focus the treatment to the surface of the teeth and gum line, because otherwise we would sterilize the good normal bacteria flora in the mouth. And this is the device we invented. So there is a oral rinse, which is inert, non-antibacterial, but when we activate that with the light, it provides a strong antibacterial effect through heat release as well as reactive oxygen. And these effect then eliminates the bacteria from the surface of the teeth and gum line and enhances the oral health to completely new level without disrupting the normal good bacteria flora. The patented method we came up with in our research was to use 2 different wavelengths of light with this indocyanine green active substance. So the substance itself attaches to the surface of the bacteria, but it doesn't do anything. But when we activate that with the red light, it provides a local release of heat and reactive oxygen, which destabilizes the cell wall structures. And at the same time, we target the bacteria internal molecules with the antibacterial blue light. The method is easy to use. We wanted to make it home usable, so you can administer the frequency needed for children as well as adults to actually provide a long-lasting, robust oral health effect. So you rinse your mouth about 60 seconds, then you activate the oral rinse for 10 minutes, and then you brush away all of that dead bacteria from the surface of the teeth and gum line. And like every biodesign fellow who has been in the program, the biggest dream is that you develop something you can start giving back to community and actually helping those patients you have observed when you were at the hospital looking at what you could improve. And for us, one of these events was with the collaboration with the Union 45, which is a dental clinic in Helsinki specialized in dental treatment under anesthesia. And there they have a lot of child patients who have so many cavities that you cannot really operate them in normal setting because that would be too traumatic for the children. So they are put under anesthesia and then they don't remember or feel the heavy dental work which is done to them because of the maybe a lot of cavities they have at the time. And how Lumoral fits to this protocol is after they have fixed all of these cavities, then there might be some cavities which are just in the development stage. We can inactivate those with this antibacterial method. Another study we have now ongoing with the Helsinki University Hospital is focused on the cleft lip and cleft palate patients. And usually these problems are fixed in the early childhood around the inside of the mouth, but during your age of 9 to 12 years old, the gums are fixed, and there is a part of bone which is taken from the clavicle and put into the gums to kind of create the bone where you can place implants to give a proper smile for these kids. And it has shown that local antibacterial therapy during this treatment can enhance the effect of a long-term patient survival or the long-term treatment effect. So for us, it's important to study how well we can improve this. Then, of course, we have a lot of other things going. So we are not only focusing on the children, but also adults. And we are running now about 15 clinical studies in different topics. But in this topic, I wanted to highlight the ones we have with the children. And also, like we say, that children cannot use always the adult mouthpieces, adult sizes. So we wanted to develop them their own kit they can use. And this kit is for children up to 4 years old. And the main focus for this is to prevent caries or dental decay. And I fully agree with Janine that with children, the prevention is essential. They have a long lives ahead. So we don't want to do invasive treatments. We want to prevent diseases and upkeep the health. The patient, what I observed in Helsinki Hospital, the patient commitment towards treatment is 100%. So they will do whatever they are needed to get better. So I think that was super motivating. Many solutions I saw there weren't optimal for children, wrong size, clumsy, not pretty much designed for adults. So the doctors needed to do different innovations to try to adapt and make the kind of different protocols to adapt existing treatments for children. The market is generally smaller, not always, but many of the children, the health issues they face with children are quite rare, especially relating to birth deficits happening, for example, heart surgery. So there is a problem in there. And that population is highly regulated. Specific clinical studies are usually needed for market approvals, and ethical standards are stricter compared to the adult population. So that's also for us that we have a specific trial studies also running, as we want to demonstrate the effect also in the pediatric population. Thank you.